I think one of the most interesting things going on in the industry at the moment is really within the National Health Service in the UK. And the National Health Service in the UK is very much embracing a much more holistic and humanitarian approach to health, in which we're concerned not so much only with diagnosis and cure, but also with the very, very, very many conditions that we do not currently know how to cure.
I think it's been a long time coming, but I think, society is beginning to recognise the benefits that arts health has in education, in health. I expect to see huge changes over the next 5 years.
We have 100% in employment, have done since the inception of the course, with a 1% variable in the sense that 1% of our 100% move in and out of various types of specialist employment, generally work on a project-to-project basis, or quite literally changing their mind about what they want to do.
In a way, the course itself is a form of experiential learning. I mean, I'm working with experiential art practice in my projects, and yet the same thing has actually happened to me here.
Students arrive with either with a particular expertise in relationship to their own creative practice, and that's true of some students. Other students arrive with a particular expertise in terms of, say, nursing or specialist education, or working with offenders or substance abusers and so on. In this sense, everybody faces a challenge, and one of the key differences between entry onto the MA in Arts Health and entry onto other programs is that almost from day one, the quality of work is pitched at level 7, it's pitched at master's level, because the first thing that everybody has to come forward with is definition of their own specialist area of praxis.
Well, it started out with me looking at sort of team dynamics through abstract art practice, but I began to realise that something was happening to the participants, and that was that they were becoming more articulate during the project. And I thought, hang on, this is really, really important. I've got kids who are a bit sort of not wanting to say an awful lot, suddenly going, oh, that was brilliant, and we did this, and describing everything. And I thought, this is really, really important. I've got to try and tinker this project to get to improve their communication, their spoken communication. So the last project I did was very much focused on that, and the results were very, very good. And I now want to, in my PhD, as it were, continue with that research, extend that research, but focus exclusively on children who have medical problems.
So there's also very much a taught aspect to the course, where students are soaking up lots of new knowledge, developing their understanding of that knowledge, going through, almost like one does with a PhD, going through a kind of collaborative process with an expert guide who then takes them through the critical and reflective rigour that's required to really unpack and understand what they've been learning, and then takes them through the skills development processes in order to be able to put that in place, and the research design processes in order to bring forward evidence that it does work. So it is quite a unique experience, because it's very unusual to have all of those approaches occurring simultaneously.
It's changing my own work as an artist. I'm an artist, as it were, in my own right. It's changing the way I look at my teaching. It's changing the way in which I react with young people. It's changed the way in which I look at the world. And I think even if I wasn't applying this in a workplace setting, it's been a really good experience for me. It's not often that you get to sort of middle age and are then able to go on this woof learning curve. Most people think that's something that happens when you're young. Well, it's just happened to me again. That was great.
Although technically the MA in Arts Health is a taught course, it's very much conceptualised through the lens of a PhD research degree.
I see myself doing this one way or another forever. I've got the bug.